Hi everyone, welcome back to your channel I Love Pharmacology. In this session, let's learn about the calcium channel blockers. So calcium channel blockers can be classified into dihydropyridines and non-dihydropyridines. So usually dihydropyridines acts on the vascular smooth muscles. So the drugs under dihydropyridines are amlodipine, clevidipine, nicardipine, nifedipine and nimodipine, whereas under non-dihydropyridines are the drugs which mainly predominantly acts on the heart. We have verapamil and diltiazem. So please remember, verapamil and diltiazem mainly acts on the cardiac smooth muscles when compared to the vascular smooth muscles. So what is the mechanism basically? So calcium channel blockers block the voltage dependent L type of calcium channels, and thereby it decreases the muscle contractility. So if dihydropyridines were to act, it decreases the calcium in the vascular smooth muscle. Thereby what happens to the vascular smooth muscle? There will be vascular smooth muscle relaxation and vasodilation. So whereas on the other hand, if the calcium dependent channels are blocked on the myocardial smooth muscles, so it decreases the contractility. That means to say it will going to cause bradycardia. So where do we use these calcium channel blockers? So dihydropyridines, except for the nimodipine, they are used in the treatment of hypertension as it causes vasodilation. It can be used to reduce the blood pressure. In case of angina, you can use, especially in case of vasospastic angina where beta blockers are contraindicated. In case of Raynaud's phenomenon where there will be involvement of the vascular system and where there will be vasoconstriction. So dihydropyridines, how to remember, dihydropyridine starts with D. Di means it dilates the arteries. Whereas non-dihydropyridines can also be used in hypertension, angina, basically in case of the atrial fibrillation and flutter where it reduces the heart rate. So whereas nimodipine was the exception where it is used for treatment of subarachnoid hemorrhage, basically to prevent the cerebral vasospasm. And whereas nicardipine and clevidipine are the drugs which are preferred in case of hypertensive emergencies or during the hypertensive urgency. So what are the adverse effects? Or calcium channel blockers can cause gingival hyperplasia, whereas dihydropyridine specifically can cause peripheral edema, flushing and dizziness, whereas non-dihydropyridines, since they depress the cardiac system, they cause cardiac depression, it can cause AV block, and it can cause hyperprolactinemia, especially the verapamil can cause hyperprolactinemia and constipation as well. And one more drug interaction one must remember is calcium channel blocker should never be combined with the beta blockers, as both of will going to depress the cardiac function. Thank you.